here from Neurobridge Mun. Their names are Brianna, Abigail, or Abby, sorry, and Theo. And just wanted to go over a few housekeeping rules before we continue on. We want to mute your mic to block outside noise. Closed captioning button is located at the bottom of your screen. Put your questions, your comments in chat. And this session will be recorded and posted on the seniors website and the YouTube channel. And Barb, if you'd like to do the land acknowledgement, please.
Okay. Hello, everybody. I'm going to read from here because I got problems with my eyes.
Speak up, my dear.
We respectfully acknowledge that the lands on which we live, work, and meet are situated on the traditional territories of the indigenous groups of Newfoundland and Labrador. And we acknowledge with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu and Inuit of this province. We honor the diverse indigenous peoples who have cared for this land for our past generations and for the 7 generations to come. We are committed to listening, learning, and working in collaboration with indigenous communities as we move towards reconciliation, respect, and mutual understanding. Let us carry this acknowledgement forward in our work and relationships as we strive to create a future that respects and embraces the wisdom of older adults and the diversity of all communities.
Thank you very much, Barb, for the land acknowledgement. So we're going to go on now to our next slide.
I can do it here with the thing if you want.
Perfect. And we have Brianna. Come here, Brianna, and talk to the world. This is Brianna. She's one of our speakers today. Theo. This is Theo and Abby Fleming. Hello. And they are first and second year MUN students, and they're going to be talking about concussions. Am I correct in saying that?
Yes.
And falls. So take it away.
Okay. Hi, everybody. So just to give a little overview of what we're going to talk about today in our presentation. So we're going to start with the definition of a concussion or traumatic brain injury. We're then going to move on to the causes of concussion. Once that's spoke about, we'll move on to the concussion epidemiology, so the origins, where they come from. We're going to talk about symptoms, diagnosis, and then how to manage and prevent. So to begin, what is a concussion? So a concussion is a type of traumatic brain injury caused by a bump, a blow, or a jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. So something you may be familiar with called whiplash. So in conjunction with this, bumps, blows, and jolts. So concussions can come from one of 3 ways. You can have direct impact, so direct impact to your brain. You can have motor vehicle accidents, a fall directly onto the head, or a blow, say from an object or what have you, directly to the head.
So like in a hockey game, or NHL gets really rough and tough.
Yeah.
Exactly.
Yeah.
You can
for direct impact.
Exactly. Yeah.
The Olympics. And the Olympics, of course.
Absolutely.
Yes, it's happening now over in Italy, more than Italy.
Yes.
I've had all that.
Yeah. So moving on for indirect impact. So this is, like I mentioned, whiplash. So your body gets hit, causing your brain to move back and forth really quick. You can have a fall causing jerking of the head and neck, or a blow to the body. And then we have physical assaults or fights, a slip or fall on the ice, especially in the wintertime, and environmental accidents, say a falling object that hits. Okay, now causes of concussion. The causes of concussion vary across different age groups. So in youth from ages 5 to 19, it's mainly sports-related injuries that concussions come from. There's a difference in males and females. So male athletes aged 5 to 19, the most high-risk sports that we see concussions in are rugby and ice hockey. So very physical contact sports we see concussions in. In females, still contact sports, but the most common sports that cause injuries in this group are ringette, ice hockey, and rugby. And then for both males and females of this age group, ATV use, so quads, skidoos, side-by-sides, accidents with them also have high concussion risk. In adults from ages 20 to 64, while sports are still part of causes of concussion, we see more from falls, motor vehicle accidents, occupational hazards, and physical assault. And then for seniors or the elderly 65 plus, the two main causes of concussions are falls and car accidents. All right, now the epidemiology of concussions. So, who gets concussions? So, it's projected that concussions and traumatic brain injuries are going to become the most common diagnoses in the next coming years. Currently, 200,000 concussions are diagnosed annually in Canada, and 85 to 95% of traumatic brain injuries are concussions. Now, we also want to look at age and gender. So the most at-risk group are children under the age of 5, and females over 65 years old are more likely to sustain a concussion. With respect to gender, males overall have a higher likelihood of sustaining concussions across all age groups. So it's important to know you can be at risk during your lifetime.
Okay, so now I'm going to talk about the symptoms that people can experience when they get a concussion. So, the symptoms of a concussion can look very different between person to person, even if they have the same injury. So, two people fall on the ice, they both hit their head, they can both present completely differently to their doctor. We divide the concussion symptoms into 4 different categories that we'll go over on this slide and the next. The first being cognitive. So these are things that impair your thinking and things that happen in your brain. So this can be confusion, difficulties concentrating, you can lose consciousness, and it can even impact your speech. So you can have difficulty finding your words or even slurring your words when you have a concussion. The next type would be physical or somatic, you may hear doctors call it. And these are more so felt throughout the body. So these are your headaches, nausea, vomiting, and you can even have some visual disturbances. So your vision could get blurry and it might be difficult to look at bright lights, even with the lighting here. That could be hard. The other 2 categories are sleep. So this can kind of go in either extreme with a concussion. So some people report feeling really, really tired and drowsy, like they can't get enough sleep. And other people feel like they just can't sleep, that they're up all night and they experience insomnia. And our last category is the emotional or the affective category. And again, this has more to do with your feelings. So people with concussions can kind of have mood swings where they're suddenly sad, they're suddenly happy, then they're sad, then they're mad. They can also experience anxiety or sadness or just general irritability. With that being said, there are some symptoms we really want to keep an eye out for because these could mean that something more serious is happening other than just a concussion. But for example, if someone's experiencing neck pain or tenderness, it could mean that they actually have an injury to their spine where their neck is, and that would require a call to 911 to make sure that that's stabilized as soon as possible so that no other injuries happen. Similarly, if someone's having a seizure or weakness or tingling in the arms or legs, this could mean that they're having a brain bleed, which would also require further evaluation. So if you are seeing any of these symptoms, such as the double vision, severe increasing headache, loss of consciousness, vomiting more than once, or increasingly restless or agitated, you are going to want to call 911 and be seen a lot more quicker than some of the other symptoms that we discussed. Yeah.
Yeah. Can we ask questions
Yeah,
now or wait until your?
No, you can go.
Can you have a concussion without having any of these things?
Any of these symptoms? Yes. Yeah. But if you do see these symptoms, you want to go to the doctor quicker than the other ones we mentioned. Because usually if you have these, it means that it's not just a concussion, there's something else going on with the brain. For example,
You could go, in my case, I didn't have any of these.
Yeah.
You could go to the hospital and get checked and they say there's nothing wrong. Is that?
One of the issues and one of the greatest difficulties with concussions is depending on where it happens, diagnosing a concussion can be very difficult. because there might be inflammation that can be found, but depending on how long it's been, or the area it's to, the doctor may say, well, I can't, it very well could have happened, but it's really hard to tell. And especially when it comes to managing those symptoms, it's there's not a lot of medications that can directly help the brain heal. It's more of a management of the symptoms. But it's definitely, if you think you've experienced a concussion, I would definitely recommend going to the doctor anyway. And if you have any of those symptoms that we associate with concussions, they can help kind of, mediate those symptoms.
We will get into the diagnosis. So, if you think that you do have a concussion, it's really important that you go see your doctor within 72 hours of when the injury happened. And this is because the tests that the doctors do, they're most accurate within 24 to 72 hours. So to make sure that we are getting a right diagnosis, you want to make sure that you're seen within that time. Also, it's important to note that seniors in particularly, sometimes doctors, it's not on the top of their diagnosis list that a concussion is what's going on. And that's typically due to other pre-existing health conditions. But that being said, it is very important that doctors do recognize that seniors have concussions, as Abby said, from falls and car accidents and those types of things.
Will they order tests, any particular tests like MRIs, if they're trying to diagnose a concussion or other?
That's the next slide. You guys are too good. Yeah, too good. Or the one after this. So when you go to your doctor saying, I think I have a concussion, I was injured, they're typically going to do two things. They're going to take a history and they're going to do a physical. So the history, they're going to want to know how you got the concussion. What was the injury? How did it happen? Where did you hit your head? Who was around? What were the immediate symptoms? And not all of the time people are going to know that information, because sometimes people lose consciousness. Sometimes people lose memories. So the doctor may request information from people that were nearby, family members, friends, those types of things. And they're also going to ask about the signs and symptoms. So again, you want to be seen in 24 to 72 hours, and the doctor's going to want to know, okay, have things been getting worse or have things been feeling a little bit better? And they're also going to screen for any of those red flags that we mentioned, just in case there is something more than just concussion, like a brain bleed or something like that. And for the physical exam, it's a focused neurological exam, so it's not your full hour-long exam. It is focused to the symptoms that we discussed before. So cognition would be your thinking, your concentration, those types of things. They would have a mental status, so how you're doing emotionally, the emotional symptoms, coordination, so your walking, your balance, those types of things, and finally your vision. So are you experiencing, if you can't look at bright lights, are you having blurry vision, those types of things. And to answer your question, most concussions do not require imaging because they're not a structural injury. So if you scan my brain right now, I don't have a concussion, and you scan someone's brain that did have a concussion, they would both look the exact same, because concussions aren't structural injuries. There's nothing actually structurally changing with the brain or the skull. However, they are functional injuries. So as Abby mentioned, it's the brain kind of bouncing up against the skull that causes it. They will perform imaging, however, if you have some of those red flag symptoms, because if you have a brain bleed, you can see that on imaging, and you do want to catch that early to intervene and give treatment.
Can I ask a question?
Yeah.
How would you know doing MRI if the blood, whatever you
Brain
say,
bleed, yeah.
bleed? Thank you. How would you recognize that? Is bruising or something?
It shows up darker on the MRI.
Okay, so it would be an MRI or X-ray or something, because I fell down the driveway, hit my head on concrete, and you could hear way back in the grass. Anyway, I didn't go right away, but when I did, they never did no X-rays, no MRIs.
Yeah.
They did absolutely.
That's what's wrong with you.
Yeah. You're not getting no more cookies.
And my fall has come against me now, I think.
It's a couple years ago, but I mean, they did eye tests
Mhm.
and looking back and forth and raising your arms. And that's about all. If anything else happened, they said come back. So how would you know if you had a brain bleed? Like, how would they, I mean, I might have had one.
Yeah, I mean, brain bleeds can come up in a bunch of different. They can come up in manifestations of, say, a headache or dizziness, or you could have vision changes. So I think that's why they did the vision. They did you turning your head to see if you had any symptoms when you moved your brain, because brain bleeds cause pressure on the skull and on the brain.
Mm.
So they could be pressing down on the part of your brain that controls your vision, causing vision change.
Okay.
They could be compressing and causing increased intracranial pressure. So that means the pressure in your brain up against your skull. And when that increases, that's when you could get headaches or different symptoms. So they may not have chosen to do imaging because of the test that they did. They didn't find any findings.
Okay, so off balance stuff, would that be?
Yeah, that could be.
Years after?
Yeah.
I guess that's
Concussion can cause like permanent alterations to those things. You know, the brain isn't always neuroplasticity, we call it. So how well the brain can heal from things. In some ways, it's amazing what we can recover from, but there's certain things that just, for some reason, the brain isn't great at adapting from. If it was a brain bleed, it would be expected to be a progressive thing. So if it wasn't treated, it would get worse over time, potentially, unless it somehow self-resolved, if it was, somewhat smaller. But if over time, the buildup of pressure, it would get notably worse. So if you're continuing to have a kind of a chronic problem, that's not to say that that wasn't caused by some damage by a concussion. But you at least know that if it's not a drastic progression, it probably didn't cause a brain bleed.
Okay.
I just want to, and everyone online, can you hear the speakers well?
Yes, no
all good.
problem.
Okay, and if you have any questions, please unmute and ask the questions as you're answering questions, am I correct, as you're going through?
Yes, of course.
Absolutely.
Okay, then.
The other thing with that is the more concussions that someone has, so your first one you may be fine, but 2, 3, your brain's ability to repair that doesn't become as good. So sometimes people get those lingering symptoms the more concussions that they have.
Oh, it's only one, so hopefully.
Hopefully you're good.
Yeah.
Go ahead.
Once blood has leaked out from the brain, now it's between the brain and the skull. Where does that blood end up eventually?
Most parts just pools.
Yeah, usually it reabsorbs after
Yeah.
a while. Depending on the situation, if it's a significant enough bleed that it's not stopping, there might be surgical involvement to stop the bleed. There might be medication to increase clotting or decrease clotting if that's a worry. Usually over time, once it starts healing, the blood will slowly absorb into just either into the CSF, so the spinal fluid that's in there, or it'll just, the body's really good at kind of clearing stuff out over time.
But if it is big enough and causing a bunch of pressure on your brain, it may need to be relieved surgically, because that pressure on your brain could cause worsening symptoms. So you always look at how bad is it and what is it doing to my body right now.
Does it stay in the head? Because of gravity, would it slowly work its way down?
I think it's almost like, I imagine kind of a hose. So it depends if you have like a hose that's, full blast, that the pressure that's happening there is going to need intervention because there's so much coming. But if you have a minor brain bleed, that's leaking almost just like a dribble out of a hose, it's going to kind of almost like how water will evaporate over time. You won't have a giant pool necessarily. It will kind of, you won't have as substantial as pressure building up. It'll kind of be able to, now over time, you would expect if there's any sort of brain bleed, that's not good. You want intervention of some sort. But if it's over time with the regenerative, you'd expect it to heal, I imagine.
Because I don't know how the brain get in the head. I'm envisioning blood has leaked out, and now because of gravity, it's slowly seeping downward. But what happens? What's the lowest level it goes to then?
I don't think it travels down the body. No, I don't think it travels down the body.
Yeah, you have these cells in your brain. They deal with your metabolism. They're pretty sure it's actually.
Yes.
That will help with the resorption of it. And again, that's just if it's a small leak. your brain does have protection mechanisms, but there's only so much space that we have between our brain and the skull, and there's also only so much they can absorb and deal with at a time. So if it's too much to overwhelm, say, your cells, then that's when you're going to need the surgical intervention.
We also have the meninges, which is a protective layer that surrounds the brain, almost like a balloon that kind of encapsulates it. So when you have that, it'll kind of keep the blood, within. It won't be kind of leaking all over the place. It will so it can be kind of absorbed through the meninges.
Last question.
Sure.
Is there at the bottom of the brain in the head
Mm-hmm.
something like a bag or layer that will stop it from going downward, or can it
No.
go downward?
So it's kind of like the brain's in like a kind of like a jelly, but it's not that thick, but that's the spinal fluid. Please correct me if I'm wrong. You guys are second year, I'm first year, so I'm not as well versed, but because we have that fluid in our brain, in our skull, it keeps it afloat. So that's why as we walk around, the brain shifts and moves as we do, and as our balance changes. A concussion is when the force is so great that it will displace it and it'll hit the side of the skull, which is abnormal for it. Usually the fluid will kind of, resist force in either direction. But there is some cases, if there's a lot of pressure in the brain, where they'll have to release some of the spinal fluid, and the brain will actually just have to sit on the bottom of the skull as it refills. And that can be quite uncomfortable for some people, but that occurs in a very rare situation. But if you had no spinal fluid, it would just sit there, but luckily we do. So it keeps it safe.
And your skull kind of goes in almost. So there's just about a hole, probably about this big, where your spinal cord, your brainstem ends and your spinal cord starts, and it goes down. But other than that, your brain is pretty encased up there.
Yeah, because your central nervous system, that means your brain and your spinal cord. So your brain is continuous with your spinal cord. So your brain ends about here, and then that then goes into the spinal cord. Your brain ends, but you have that connection between the brain and the spinal cord. That's all encapsulated in what we call the meninges, the cerebral spinal fluid. So that entire system is encased in its own little covering. And you have the blood-brain barrier, which protects your brain sometimes from the body's infection. So you have your brain, your blood-brain barrier, and your body. So if the bleed was big enough, I'm not sure how correct this is. If the bleed was big enough and it needed somewhere to go, I think it would stay in that system itself. I don't think it would go to like your brain.
Stomach.
Yeah,
Like that.
it would stay in its little system. Does that make sense?
Yes.
Perfect.
And I don't want to be taking too much time myself,
No, you're
but I
good.
imagine something like when bullet wound happens or somebody gets down, blood leaks.
Mhm.
So when that blood leaks, where is it going into the body? Is it going towards the
Yeah.
feet or something because of gravity flowing
Yes.
downward?
Brain's a little bit more protected.
Yeah.
There.
If you get a blow to the body, your body's it's full of cavities. So you have your abdominal cavity, so that's where all your abdominal organs are. You have it's called retroperitoneal cavity, so it's in the back. That's where your kidneys live. You've got your chest cavity. You've got your lower extremities. So they have different compartments in your legs and in your arms. But yes, you're right, with gravity, it will go down in its own cavity. So it moves in cavities. Injuries usually stay within the cavity.
Blood would never reach the feet.
It probably would.
Well, more likely, blood from your feet will end up getting pumped back up to your heart, and then pumped other places in your body, and then
No, the rupture that happens in a blood carrying vessel, blood leaks.
Yeah.
That blood that has come out, where
Gravity
does it eventually go?
follows gravity.
Yeah.
I think.
yeah.
Yeah, I think.
Yeah.
I don't know.
If it's just leaking out, I would imagine it just goes into the environment,
No, but within the body.
Within the body.
Oh.
If there's a blow to an artery in the body.
Sure, yeah. So it just will kind of diffuse. It'll pool in that area. So that's why, for instance, you can get infections, right? If you if you were to nick, let's say, a bowel, that's why we can get pretty severe infections, because we don't have, there's not, if the walls are nicked, then, bacteria can spread from one area to the other. So
Just where would the blood go?
yeah, so if the artery,
Enough
it would just
gravity.
disperse, and it would just plot around there.
Yeah.
Yeah. Pretty well.
I wish we had the answers to everything.
No,
Yeah.
You know, don't give me a wrong answer if you don't know.
Yeah.
Yeah.
No, because I'm asking, but.
Yeah, sure.
Yeah.
I think we've covered this, but I don't think I mentioned the skull fracture. If you do feel a skull fracture, you're also going to want to get an image because obviously that's a structural problem.
Yeah. You will feel a skull fracture.
Yes.
Oh, okay.
You'll feel
Yeah.
that.
Yeah, they did do that. They touched where it was. And
Yeah.
stuff like that, so.
Good. So just to summarize all of the diagnosis procedure. So first, if you see your doctor, they're going to rule out any more serious injuries. Again, seeing if things are getting worse or if things are getting better, or if we have any of those red flag symptoms that mean, hey, we need to go to the hospital now and get seen ASAP. Then they're going to diagnose a concussion, again, based on the history and the physical. And usually they'll have a standardized assessment tool where they'll go through like kind of like tick boxes. Okay, they have this symptom, this symptom, this symptom, this symptom. This is likely a concussion. They don't have these symptoms. It's likely not a brain bleed. And then finally, the doctor should provide you with education and ways that you can manage the symptoms and hopefully have a good recovery, which Theo is going to get into.
All right. So far, Abby led us through the different risk factors that put us at risk of getting concussions, such as age, gender, and occupation. And Brianna brought us through, the different symptoms of concussion. And so we know that concussions can look really different for different people. And there's other things that can happen at the same time as a concussion if you've had a really severe injury. That if you have signs that look a little abnormal, you really want to bring to your doctor. But if you do incur a concussion, there's things we can do to try to prevent them from happening and also just to manage one that's occurred. So as Brianna mentioned, within the first 24 to 72 hours that you expect a concussion to have occurred, you want to go to your doctor and get that conversation rolling so they can do a good assessment of you. The first thing they're going to suggest is prioritizing rest for 24 to 48 hours post the event to monitor for new or worsening symptoms. So the doctor will say, hey, I think you have a concussion. The neurological criteria, you meet them, I'm pretty sure you have concussion. I don't think anything else is happening, but just to be safe, when you go home, keep an eye on things. If you feel yourself getting suddenly dizzy, maybe you start throwing up or anything like that, make sure you come in because you don't want to have missed something the first time that's progressed. So during that time, there's a few things you're probably going to want to avoid, such as screen time. This is because when you're after a concussion, you can have some eye sensitivity. So looking at a screen can bother your eyes, as well as driving. Obviously, if you have some motor skills that maybe have been infected, or your vision's a little blurry, you don't want to be driving. And moderate physical activity. So anything that will worsen symptoms. If you find yourself getting dizzy, if you're moving around, maybe take a seat for a little bit and let yourself rest. Or if you find, leaning over is causing a worsening of symptoms, try to avoid things like that. But they do promote light physical activity. So doing some slow walks, I've heard before, motion is lotion. So there's a lot of things that just physical activity, it helps circulation in the body. It helps move, all of the different cells that help fight the immune system and rebuild after an injury. It moves everything around. So some light physical activity is great. And early symptom management, potentially that could look like pain medications if you have a headache and so forth. Discuss with your current healthcare professional how your current medications may impact your recovery and about medications and techniques to manage symptoms. So this is particularly important if you're on, for instance, a medication that's known as a blood thinner. That'll be important to mention to your doctor or anything such as that. And if you do have a headache, mention to your doctor, is it okay if I take painkiller? What should I take? If I get sick, what should I do or should avoid?
Question.
Yeah.
It's time to get a doctor's appointment.
Sure.
Is a pharmacist qualified enough to ask questions on that?
I would, I mean, in a perfect world, we would have access to a doctor immediately. I think, using 811 or some form to get in contact with a healthcare professional, whether that's a nurse practitioner, is important to have that immediate assessment. Just make sure there's nothing, other neurological condition happening. Yeah. But if you're at the pharmacy afterwards and you want to double check with something, pharmacists are great to have those discussions with. But I would, if you need to go to Emerge and that's the quickest way, sometimes that's what happens. Unfortunately, we know health science can take a long time waiting. But weighing the benefits and the risks is
It
always
doesn't hurt to ask. There are
Yeah.
pharmacists that are trained in to make diagnoses of a lot of things like
Mhm.
UTIs. There's a bunch of things that they're able now to do. I don't think they would be able to diagnose a concussion, but it is worth an ask because pharmacists are trained to do far more than people think now. Yeah, 100%. So if that is what you have access to from the beginning, definitely do it.
And if you have any concerns about medications or if, will this make my symptoms worse,
Yeah.
stuff like that, pharmacist is definitely the one to ask. And also, we're saying this now, but their scope of practice keeps expanding.
Yeah.
Very true.
So in the next couple of years, that could be something that they can manage.
And honestly, it's probably the doctor calling the pharmacist to see if there's any drug interactions.
Yes, for sure. And and always calling 811 if you're not certain on what to do. They can give a great idea of things. So now we're going to talk a little bit more about specific symptoms. So for headaches, self-management, we're going to avoid triggers. So again, screen time, hydration, and balanced nutrition is always important. That might look like, avoiding things like alcohol or smoking during that time, making sure you're drinking water, passive therapies. So that might look like some people use pressure points or massage therapies. If that works for you, you can try things like that. Hot and cold packs can also be very relieving. And then medical management. These are over-the-counter things like Tylenol, Advil, and Aleve. And sumatriptan is used for migraine headaches. If you do have migraines typically, that might be something you have. I don't know if that's over the counter.
No, you have to be prescribed that.
Yeah.
Yeah, I was gonna say.
Yeah.
So if you're someone who has a history of migraines, you may have access to the medication. Talk to your doctor, and you might be able to use that as well for headaches related to concussions. Difficulty sleeping, as Brianna mentioned before, we can manage that by prioritizing sleep hygiene, which is just to say prioritizing the bedtime routine to make it as calming, as restorative as possible. So that might look like putting your phone away before bed for a little bit. Taking a bath before bed, just really relaxing yourself, making sure you're making your environment as comfortable as possible for yourself. Avoiding stimulating foods and substances. This could look like caffeine, avoiding caffeine towards the end of the day, and also avoiding really heavy meals. Sometimes, sometimes we would have what's called a night lunch. We would go down and have a late lunch, and they're delicious, but sometimes they can make it a little difficult to go to sleep afterwards because the body's spending time digesting it. So, maybe having a lighter snack will help you get to bed get to bed better. And CBT if moderate to severe insomnia, that's cognitive behavioral therapy, right? That's referring to there.
Yep.
Yeah.
Yeah. So
no, there's insomnia groups, and I've heard that they've been really, really effective. It's kind of like an online Zoom type thing where people that do suffer from insomnia will get together with a therapist and they'll talk about it. And it goes on for several weeks. But from what I've heard, it's been incredibly effective for the people that have used it.
Awesome. I didn't know about that. Thank you. In medical management, melatonin, that is very easily accessible at different pharmacies, magnesium, and low dose short-term use of trazodone or tricyclic antidepressants, but those would be prescribed by your doctor. But talk to your pharmacist and they will
Theo, what about the lights for helping your circadian rhythm?
Sure.
Those lights to
absolutely sleep. Yeah, some people I know for getting up in the morning, it's a great thing because some people find it really hard to get up in the morning, especially making your sleep schedule more regular.
Yeah.
It can be it's these alarm clocks that will they'll start to glow and brighten up the room at the same time as the sun would, and it can make it more natural to wake up to. A lot of people say anecdotally that being outside throughout the day helps them go to sleep at the end of the night because it gives your body the understanding that, okay, it's nighttime. I've seen the day and now it's the night. I can see the darkening. So being outside is great for your body anyway. That can also help with sleep if you're having difficulty there. And mood. This is something that's not often associated with concussions, but it's very important to talk about. Because once you have a concussion, there can be a lot of changes to mood, such as anxiety, depression, that might be an irritability that might be uncharacteristic for you. And it can be hard to talk about, but there are lots of things available. Various types of therapies can be very helpful. Cognitive behavioral therapy is the most, we have the most evidence to support, but there's naturopathic therapies, just talking to loved ones can be very helpful.
I don't mean to interrupt you, Cole.
A little bit.
Yeah, we should turn down the air conditioning.
Just the air conditioning.
Yeah, sure. Yeah.
Very
I can just close
Turn
it.
off one.
I think so.
Turn off flap or something.
Nope, that's not an off button. I thought it was.
You're doing that. Oh. Really?
You know a lot, Theo, for a first year student.
Rest.
My undergrad was in behavioral neuroscience, so I'm a little lucky in that way. But thank you. For medical management, kind of as we would associate with some different mental health conditions, you can use SSRIs such as citrulline and alternative SSRIs, SNRIs. All this to say, these are medications that can be prescribed for treatment of depression, anxiety, and symptoms. It's not a cure-all, unfortunately, but it can really help with some of the symptoms, especially if you're struggling with it. And that would be through your doctor prescribed. And then there's a general return to activity protocol. So you've had a concussion. Okay, what's the schedule? What does that recovery timeline look like? And the first step is going to be activities of daily living and relative rest. So you're resting, you're staying as comfortable as possible, and only engage in activities that are, mildly uncomfortable or mildly worsen symptoms for brief periods of time. That might be, I need to go to the grocery store. It's great if you have help to go to the grocery store and help someone can pick it up or you can order it, but maybe you can't do that. So that would be something you go do, but you try to keep it as restful as possible. Then step 2, you have a light to moderate effort aerobic activity. We just say that as in not intensive. You're not going to go lift weights. You're not going to be hitting the gym, but you're going to do some light activity. So you might walk around a little bit, maybe take a little walk around the block at a slow pace. Maybe it's a little chair yoga, things that just kind of help you work back up to more moderate intensity. And then you can increase your activity to things that are normal for you. So maybe that looks like a jog, maybe it looks like a walk around the neighborhood. As you feel better, you can start integrating those things back.
Does one self determine how he's progressing, or would the doctor regular checkup say, okay, now I think you're better? This step.
So, I mean, as you mentioned before, how doctors can be so hard to get a hold of. Usually they'll give a timeline to say, if you're starting to feel better at this point, that's when you can start doing it. Because it can look so different for everybody, right? You can have somebody who, even the impact, it doesn't seem like that big a deal. But I say that on quotes for people who are online. But depending on just how the brain absorbed that impact, can cause some really serious symptoms. And that can take a long time for that person to gain those, that comfortability with physical exams back, or physical exercise, sorry. So long story short, the doctor will likely give you an outline, but how the recovery looks often changes. Some people are really fast on the recovery and they can get back a lot faster. In that case, I would still check in with your doctor just before maybe returning to work. If you're a week out and you're like, man, my doctor gave me 2 weeks, but it's been a week, I feel great. Check in with your doctor just to make sure, because you also don't want to return too fast with too much effort and then cause, worse damage to yourself.
I'll add one thing to that.
Yeah.
Concussions are often also followed by physiotherapy.
Mm.
So that's an important modality. I know sometimes physiotherapy can be expensive if you don't have insurance, but often people, especially athletes who are followed for concussions and even seniors, physiotherapists are great with concussion protocols, and they're a little bit easier to access than doctors. So they can also, you can follow up with them and they can follow your treatment plan. If you're someone who you think you need a little bit more structured treatment, you're not sure if you could do it on your own, they're also an avenue to explore, because doctors could be possibly able to do that.
Absolutely. And occupational therapists as well on that note, especially if you're struggling with some of the symptoms such as, balance, perhaps you're struggling with afterwards. An occupational therapist can be very helpful in kind of giving you exercises and aids to help that recovery. And then return to regular activities with medical clearance and tolerance of regular activity. So cognitive tip, the 4 Ps is going to be, as you're returning to everything, prioritize, pace, plan, and positions. Do you have better insight into what this is on?
So you want to prioritize your recovery. Don't take it too fast, but also listen to your body. And if you're feeling better, we move to the next step. You want to pace yourself, right? Just like I said, don't do too much too fast. And in the prioritize, you want to prioritize your wellness in the first 72 hours, because that's when you're at most risk, like up 72 hours of the injury. You want to plan, so getting treatment planned, following up with a doctor if something goes wrong, planning to see the right specialist, and positions. That one, I guess, would be if you're sitting and you don't feel well, lie down. If you're lying down and you don't feel well, sit up. Just listen to your body. I think that's the main thing for this, especially where concussions present so differently in everybody. You know your body best. So it's just important to listen to your body, and whatever your body needs, see what we can do.
And I think as well, as fall risk increases, being more aware of that within yourself and your body, knowing your body's limitations for those things, and taking that extra step, saying, I could just walk down these stairs, but I know myself, I'm just going to make sure I'm on the side with the rail, and I'm going to hold on to the rail as I go down. So prioritizing just these little things in your everyday life to put a little extra safety into your step. And as I was mentioning, to reduce fall risk, you're going to look at increasing your balance, strength, and flexibility. As that could be through physiotherapy, but that could be through little actions. Chair yoga is a big thing, where if you don't feel you have the mobility to do entire yoga, it's just doing gentle stretches from a sitting position. And, kind of doing those weekly things to increase your balance and strength can be really critical, especially as we're getting older. The risk for falls are increasing, and the risk of having more complicated fall is increasing. Proper medication management, making sure that if you have any conditions that you're living with, making sure those are managed, and you're not at risk of if you have high blood pressure or low blood pressure, risk of dizziness or unbalance can be a potential symptom. So making sure those are managed. Using a cane or a mobility aid can be extremely helpful, and giving yourself a sense of freedom with that and a sense of comfort, and using handrails or guide bars wherever possible. And the last thing is just a plug for Parachute, which is a Canadian national charity for injury prevention. And they have a concussion education app. So if you'd like to scan that with your phone, you can, but also you can just search it up at Parachute. And they give guidelines for teachers, athletes, stuff like that. So if you have a loved one that's up to a lot of sports and you're a little worried for them, you can always throw that their way, and maybe they'll find that interesting. And thank you so much for listening.
Thank you. Oh, yeah. So, Courtney, do we have any questions for the online people?
No, I don't see any questions in the chat right now. But if anyone has any that they want to pop in there, I can for sure read them out.
Thank you. I got a question.
Go ahead, Rick.
If you've had, hurt your head and when you were younger, and they said there's nothing wrong, it wasn't a concussion. Could you in later years, like when you're 92, could the effects of that come to you? Have in your findings, have you
Sure.
ever?
I would say, in my understanding, not usually, but it can be the case that there's some things that are not noticeable until later. For instance, if you have a child who has a head injury and they appear fine, everything's great, but as they get later into schooling, maybe that did cause a little bit of a difficulty for them for reading. And we're just not aware of that until they get further into those reading or difficulty focusing. And we don't really connect that until it's later in life. So that can be a possibility in that case, but you wouldn't have a worsening of symptoms, luckily. So that can be.
Because it's like the last couple of years, I'm having trouble with my balance, or that could be something else.
Yeah, I think unless there was if there was a physical blow that you can recall, or an incident where you had discomfort like that, that might be something to consider. But unfortunately, balance can be a result of a lot of different things.
Yeah,
So
I realized that. And the other question is, in your findings, your research, is there any relation between concussion and dementia?
So there is an association between concussions and what we call a traumatic brain injury. So a traumatic brain injury is pretty much an injury to the brain that makes it not work the way that it used to. And this can present in a lot of different ways. Your brain controls a lot of stuff, as we know. So that could come up as balance issues. That could come up as speech issues. It could come up as vision issues. So the more concussions that you are having, the more likely you are to get that type of injury. I don't know. Sorry, you might have to repeat your question for me.
Is there a link between concussion and dementia?
So there could be that link there with your memory, especially if you're having concussions throughout your life. But typically, you would see those memory problems after you've had a couple of those concussions. I haven't directly seen, okay, I've had a concussion when I was 10 and I'm going to get dementia when I'm 80 type thing.
Yeah, because I guess they really don't know what causes dementia.
Yeah.
Yeah. And just to add on to that, I think dementia, one of the ways it can occur, such as when we talk about Alzheimer's, is it's a presence of a protein that occurs in the brain and basically starts plugging up stuff so that messages don't get through as well. If you're somebody and there's kind of the correlation where as you get older and your chances of having a fall, having a concussion might increase, your risk of developing Alzheimer's or that to start progressing and start symptomizing, that can also happen at the same time. So there's a bit of a correlation.
And it's really prevalent today and in younger people,
Yeah, absolutely. And that's a dementia, it's such an interesting topic in terms of brain health.
Dementia is one of those things too where it's not can't really pinpoint, okay, this is what causes it. It's genetics, it's your environment, it's what you eat, it's what you do. It's your whole life pretty much.
Yeah. And as, umbrella.
Yeah.
As you get older, like Theo was mentioning of neuroplasticity, so your ability of your brain to make new neurons. So neurons are the cells that control your brain. So neurons make up your brain. As you get older, you're less able to regenerate those neurons as they die because neurons are on a life cycle, right? Just like the cells in our body. They live, they die, new ones come along, right? It's that cycle. As you get older, that cycle doesn't happen as often. So you start to not lose, but you don't get the regenerative power that you had when you were younger. So traumatic brain injuries can tend to show up because your brain isn't able to repair what had happened. So it's a combination, like Brianna said, it's age, it's environment, it's your brain, it's your body, I wish we had answers, but nobody has answers.
Maybe one day.
Sometimes.
It certainly would.
No one. Unless you had an autopsy and then you're dead, then you wouldn't get.
We'll never know.
Yeah.
Thank you so much.
Yeah.
Any questions?
Thank you.
Any questions? Anyone online with questions?
Very informative, I gotta say.
Awesome.
It's very informative. Thank you, Abby. Thank you, Brianna, and thank you,
Yes,
Theo.
thank you.
I got our names.
Sherry, there's actually one question that just
Oh,
popped up in the chat.
Sure
So
thing.
Sharon said, "Is there a safe way to fall?"
Good question.
There absolutely is, and it's really and there are some programs now that are trying to look at safe falling, and you know, for groups that are more at risk of falling. There's I'm not very well informed, other than the fact that there is a way to do it, and ways that you can kind of, you know, when we go rock climbing, I go rock climbing time to time, and there's a way to fall to reduce the impact that it has on the body. And there's ways that when you're falling, especially, you know, let's say you're tripping up, that we can, you know, kind of cradle ourselves to be able to brace better and recover from that and help ourselves up. There's some, I wish I had a link that I could give a resource to, but there is ones available and they're growing in popularity because we're realizing how important it is. So I definitely recommend taking a look at fall prevention and safety. They're out there and they're wonderful.
The other thing is you definitely don't want to hit your head. And also falling with your arms outreached like this, it's really common to break your arm doing that. So that's another kind of you don't want to hit your head and you don't want to fall like this.
Yeah.
You almost like, I know you don't think this as you're falling because it's unexpected, but to roll. Almost like
Yeah.
There is.
Sort of like that.
And the wonderful thing about those workshops is it gives you a chance to practice. And because, you know, in theory, it's easy to, you know how to safely fall, but in the moment it can be really easy.
Some soccer players, they fall on their back and they curl and roll.
Yeah.
Tumble.
Exactly.
The head as much as they can.
One of the reasons they do that too is if I'm just hitting my elbow here, I'm getting all the force of my body on my elbow. But if I'm hitting all up here, it's kind of more dispersed. So I'm less likely to break one bone because it's not my whole weight on that one joint. You know what I mean?
It's like walking on snow without snowshoes.
Yeah.
Oh, yes, yeah.
Yeah.
You know what I mean? Does that make sense?
Yeah.
Yes,
Yeah, okay, cool.
Yeah.
I was saying when they fall on their back, they curl their
Yeah.
forward,
Yeah.
so the head is the last.
Yeah.
point
Yeah.
in
And
front.
there's usually there's a tendency to roll as well while they do it, because as you're moving, you're dispersing that momentum. And yeah, so there's lots of definitely some videos out there. So I definitely, if that's something that you think would make you feel a little more empowered, certainly.
That was an excellent question though, and I think that we should add a slide on
Yeah,
that, to be
we
honest.
definitely will.
Thank you.
Is there any more questions there, Courtney, in the chat?
Nope, no more questions in the chat.
Okay, then, so we'll continue on here.
So what I was saying, we're also getting the benefit.
Ask questions?
I think-
So I just wanted to,
But then we'll put it out.
I just wanted to let you know, for people online and people here, that as seniors in L, we provide information, referral, service, walk-in, housing, financial, health, daily living, grief and bereavement. We also have community outreach and engagement, which we have here today, the Tea and Talk. And we have different varieties of speakers coming in from time to time. And we also have social prescribing, link workers working with our NL Health Services and in our family care team. So social prescribing is a means of connecting individuals to a range of non-clinical services in the community to provide their health and well-being. So join us for our upcoming learning sessions next week, tomorrow, February the 11th. Let's learn about digital seniors NL, presented by Sarah Natson, founder and CEO. And our next Tea and Talk will be prepared for emergency at home on February the 17th. And that's presented by Lori Hindi, Community Engagement, Eastern Newfoundland Labrador Red Cross. And of course, if you have any other further questions, you can always write info@seniorsnl.ca or follow us on Facebook and Instagram. Well, thank you for coming and thank you.
Thank you for having us.
Thank you.
See you again.
Hope to see you again.
Barry, I don't have information about what happened to normal.
53 years. Anyhow, come over here, you young.
Come over here, you.